Levetiracetam, also known as Elepsia Xr, is a medication used to control and prevent seizures in people with epilepsy. It is classified as an anticonvulsant, which means it helps to reduce the occurrence of seizures. Taking Elepsia Xr 1500 mg tablet daily can help decrease the number of seizures you may experience. It is best to take this medication at the same time each day to maintain a consistent level of the drug in your body. Always follow your doctor's instructions for the proper dosage and timing of Elepsia Xr. Before starting to take Elepsia Xr 1500 mg tablet, it is important to read the medication guide and the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for more information. When taking the liquid and regular release tablets, follow your doctor's instructions, usually taking them twice daily with or without food. Be sure to measure the liquid form of the medication carefully using a special measuring device/spoon to ensure the correct dose. If you are prescribed the extended release tablets, take them as directed by your doctor, usually once daily, and swallow them whole. Do not crush or chew the tablets to avoid releasing all of the drug at once, which can increase the risk of side effects. The dosage of Elepsia Xr 1500 mg tablet is based on your medical condition and response to treatment. It may also be based on weight for children. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It is important to take this medication regularly at the same times each day to get the most benefit from it. Do not increase your dose or use it more often or for longer than prescribed, as it will not improve your condition any faster and may increase the risk of side effects. Do not stop taking Elepsia Xr 1500 mg tablet without consulting your doctor, as suddenly stopping the medication may worsen your seizures. If your seizures last, change, or get worse, be sure to inform your doctor. If you experience drowsiness, dizziness, unusual tiredness, or weakness, especially during the first 4 weeks of taking Elepsia Xr 1500 mg tablet, these side effects should lessen as your body adjusts to the medication. However, if these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. However, it is important to notify your doctor immediately if you experience any serious side effects, such as loss of coordination, mental or mood changes, signs of infection, signs of anemia, or easy bruising/bleeding. In some cases, people taking anticonvulsants may experience mental or mood problems, such as depression or suicidal thoughts. It is crucial to seek medical attention if you or your family/caregiver notice any unusual or sudden changes in mood, thoughts, or behavior. Levetiracetam, the active ingredient in Elepsia Xr, may cause a rash, although this is usually not serious. If you develop any rash, it is important to inform your doctor immediately, as it may be difficult to distinguish it from a rare rash that could indicate a severe reaction. While a serious allergic reaction to this drug is rare, it is important to seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that the information provided here is not a complete list of possible side effects. If you notice any other effects not listed, it is advisable to contact your doctor or pharmacist for further guidance. Before taking Elepsia Xr 1500 mg tablet, extended release anticonvulsant, Pyrrolidine derivatives, it's important to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. Additionally, make sure to disclose your medical history, especially if you have kidney disease or mental/mood disorders. When starting this medication, be cautious as it may cause dizziness or drowsiness, especially during the first month of treatment. Avoid alcohol or marijuana, as they can worsen these effects. It's important not to drive or operate machinery until you are sure you can do so safely. If you are using marijuana, it's essential to talk to your doctor. Before undergoing any surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that children may be more sensitive to the side effects of this drug, especially mental/mood changes. Children under 4 years old may be at a greater risk of increased blood pressure while using this medication. Additionally, older adults may be more sensitive to the side effects, which can increase the risk of falling. If you are pregnant, it's crucial to discuss the risks and benefits of this medication with your doctor before using it. Similarly, if you are breastfeeding, consult your doctor before continuing to breastfeed while taking this medication. Now, let's talk about the potential drug interactions with Elepsia Xr 1500 mg tablet. It's important to be aware that drug interactions can alter the way your medications work and may increase the risk of serious side effects. Remember that this video does not cover all potential drug interactions, so it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Also, don't forget to seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. One product that may interact with Elepsia Xr 1500 mg tablet is orlistat. Be sure to discuss any concerns with your healthcare provider to ensure the safe and effective use of this medication. If you or someone else has taken too much of this medication and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing and loss of consciousness. It's important not to share this medication with others. Your doctor may also order lab or medical tests, such as kidney function and complete blood count, while you are taking this medication. In children younger than 4 years, blood pressure may also be monitored. Make sure to consult your doctor for more details on these tests. If you forget to take a dose of Elepsia Xr 1500 mg tablet, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When storing Elepsia Xr 1500 mg tablet, extended-release anticonvulsant, pyrrolidine derivatives, make sure to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. If you no longer need this medication or if it has expired, make sure to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the correct way to discard this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.